week, scientists from Duke Medical School had developed a new approach using the Zika virus to destroy brain cancer cells and inhibit tumor growth while sparing healthy cells. Today, we're joined by Dr. Colin Hayward to talk to us more about that. Can you talk to me a little bit about that headline and your first impressions of what that might mean?
Sure, yeah, I saw that, and yeah, some exciting news again in glioblastoma, which is, you know, a really difficult cancer to treat and really has a terrible prognosis still for a number of people. But let's go back and talk about the immune system.
Okay.
First of all, it's because glioblastoma is so difficult to treat.
Okay.
And Zika virus, we think of Zika virus as something that's a mosquito-borne illness, right, that affects people and can give them a flu-like illness over a few days.
Right.
But actually, here it is, this illness carried by mosquitoes that could potentially, and it's important to say potentially right now because it hasn't been proved,
Right.
but in this experiment, it could help treat brain cancer. And that is perhaps another new way of doing something that we have known for quite a while in terms of helping our body's immune system fight against the cancer that goes on. If we talk about cancer, how does it evolve? You know, we have billions of cells in our body that are dividing every day and growing, and it just takes one of those to go rogue and to evade our normal mechanisms and cause and form a cancer, a cancerous growth. Normally, our body sees these rogue cells and, like a bacteria or a virus that invades us, picks it out, kills it. That's our immune system working naturally every day. But sometimes that cancer can avoid the immune system. And
Or
it does that.
even hide. I saw an article the other day about how those cells can actually hide from our immune system.
Exactly, yeah, for sure. Because then what they do is they create their own environment, their own little ecosystem around them that promotes their own growth, so that it causes angiogenesis or blood vessel formation, so it delivers the nutrients that they need. And it creates this environment that helps them evade that immune system by almost like a cloaking effect and cloaking themselves away from the natural cells that go and clear them up and take them out of the system. So, you know, with brain cancer in particular, it's really a tricky one to treat because that environment is such a diffuse environment, such a complex environment of cells that it isn't ring-fenced, it isn't a clear structure that can be taken out. You know, obviously the brain's a very significant, complex organ, and so there's little micro tendrils of this ecosystem that come out, and often, like many cancers, by the time it's discovered, by the time the symptoms show, it's already spread perhaps beyond any surgical intervention. And so that's what's really important here with this Zika virus, is perhaps the virus infecting those brain cancer cells can make it more attractive, if you like, more visible to the immune system, and therefore can help take it out. And I think that's the way the research is going.
It is interesting the way that we see that a lot in the medical space in general, right? We're constantly looking for ways to just be able to see that there is a problem, right? To have a clear diagnosis and to be able to move forward to the treatment phase.
This is not necessarily a super new concept.
Right.
The concept being the Zika virus, but bladder cancer, for example, has been treated for a while with BCG, like the essentially TB type bacterium, mycobacterium, that is injected into the bladder, and that enhances the immune response and then helps the immune response against the squamous cell carcinoma of the bladder. And so, you know, bacteria, viruses can help stimulate the immune system and avoid that evasion of the immune system that cancer cells have.
Yeah, that's an interesting perspective. You know, while this isn't proven to be effective, something similar has occurred in the space before and was beneficial to you, at least diagnosing cancer and seeing that it's there.
This is an area in terms of, you know, many areas of research that we look at for treatments that could be one of those techniques that we use to stop a cancer evading, hiding in our own bodies, and actually then unmask it and make it open to attack from our own immune system that could, and I think it's important to say could, it's going to be many years away before turning this into an effective therapy.
Right.
because of that development process and the timelines associated with that development process, it could help us in terms of having better therapies, getting nearer to longer survival times for patients who are discovered to have brain cancer.
Thank you so much for going over this article with me in a way that's easy to digest and then disseminate for our audience. And I appreciate you and your time and your expertise, and I look forward to meeting with you again soon to talk about some other cancer research that's in the news. And I appreciate your time, Dr. Hayward.
You're welcome. Thank you very much.